Namaste. Welcome to the Living Ayurveda lecture series. I am Dr. Aruna Iyengar Rao and will be talking about the infamous rheumatoid arthritis called as Amavata in Ayurvedic terms, which has been a very concerning joint disorder since all times. We are going to explore what the science of Ayurveda has to offer in giving a profound and exact perspective of the causes, pathogenesis, symptoms and treatments expounded in various texts like Charaka Samhita, Madhava Nidhana, Sushruta Samhita and Ashtanga Hridaya. Have you been experiencing either morning stiffness of some of your joints, severe pain associated with inflammation or swelling of joints? It can be most likely diagnosed as Amavata or the rheumatoid arthritis, which can be either serum positive or serum negative. It is categorized under the autoimmune disorders by the modern medical system. To get an exact picture of the disease, pathogenesis and prognosis, we need to understand the concept of Agni, especially the Jatara Agni or Udara Agni. What is this Agni or the fire in the body? It is one of the 5 elements of nature, the other 4 being earth, water, air and ether. Agni is responsible for digestion, metabolism, the intelligence, our skin complexion, our aura and all life's activities. The food gets digested, absorbed, assimilated and segregated by this force called as Agni. This Agni can be regarded as an all-pervading energy both in the body and outside the body, in the whole universe. We are alive due to the functioning of the Agni in a normal, harmonious way. Death or disease can be due to a decrease or an increase in the functioning of the Agni. To understand this disease better, we need to delve into the relationship between Agni and Ama. Weak action of the Agni results in ill-formed, undigested food which is not assimilated. This is called as Ama. The first product of digestion is called Ahara Rasa and consequently the Rasa Dhatu, the first tissue to be formed in the body. Due to the hypofunctioning of the Agni, this Rasa Dhatu is ill-formed. This itself can be called as Ama. This Ama can be rightly said to be the root cause of all the diseases. Hence, interestingly, the term for the disease is called as Amaya in Sanskrit. And more importantly, yet apt name given for the stomach is Amashaya or the abode of Ama. This improperly digested food due to the retention in the stomach gains the form of decayed material and further gains the form of poison. Thus, undigested food or Ama leads to the formation of Anna Visha, which is responsible for the manifestation of many and most of the systemic diseases, given the fact that poison shows its toxic effect very quickly. One of them being Amavata or the rheumatoid arthritis that is being discussed here. Now let us see what are the probable causes for Amavata or the rheumatoid arthritic condition. Eating of unwholesome foods such as fermented white flour or the maida, which includes bread, pizza, biscuits, burgers, and some of the other fermented foods like cheese, paneer, or the milk powder. Stale or refrigerated foods, one-day-old foods kept in the fridge and again reheated and had, or eating cold foods without heating them, or keeping the idli dosa batter for 2 to 3 days and consuming it on and on, and eating while not really hungry, or eating a meal and immediately exercising, or eating a meal and immediately going to sleep, or having a sedentary lifestyle, continuous exposure to cold air. It could be because of constant traveling or because of air conditioning, and also sluggish thinking or more of the tamasic guna in the person. Let us see how this disease manifests in the body. The pathogenesis of Aamavata or rheumatoid arthritis. What is it that we have to observe? Indulgence of the causes, what I have mentioned before. This forms the Ama. This increases the Vata and pushes the Ama into circulation. Vata is a force which is helping in movement. This moves the Ama to bony joints, muscles, and this Ama gets vitiated further and mixes with Pitta, and then it lodges in the knee, hip, pelvis, etc., causing the severe pain and inflammation in these joints. What are the symptoms? Angamarda or pain in most of the body parts, feeling of heaviness in the body, Guruta, Pipasa or a constant thirst, or having no taste or no interest in having food, Aruchi. Sometimes can also lead to Amla Pitta state, that is, you can say acidity. Shodha, that is swelling of joints and other body parts. Then a constant feeling of Antarjvara or fever within the body. Now, what does Ayurveda have to offer in the form of treatment? First treatment is Nidana Parivarjanam Eva Chikitsa. Avoidance of causes itself can do a big deal to come out of most of the symptoms of Amavata. Avoidance of causes. Then coming to Panchakarma, we have various types of Panchakarma like Virachana or Basti, etc. And of course internal medicines to digest the Ama which has been lodged in the different joints and the body parts, and to improve the Agni. So Agni Deepana is done. That is, Ama Pachana and Agni Deepana is the main line of treatment, and the relief from pain and inflammation is the consequent steps. Definitely some particular yogasanas, pranayama and meditation, dhyana will hasten the process of healing. I have treated many cases of Amavata or rheumatoid arthritis in my clinic since the last 8 years of my experience, and I've just presented 2 of such patients here. You can have a look at it. Most of the patients treated are completely free of medication and treatments. A few of them require a continued internal medication to maintain, to make sure the Ama doesn't accumulate in the body. Again, it depends from case to case. If you want to consult me online or in person, I am available. You can book a slot on Calendly, or you can visit me in Dombivli in Maharashtra. I have provided the details in the description box below. So, have a great day. Namaste to one and all.